I'm going to try and give you like the usual 20-minute convergence of a bit of what's now, near, and next, kind of a bit of a frame setting for what's going to come in the next 4 days, and help us sort of think about where we're moving, right? Our era is now much more digital, somewhat more super connected, a little bit more intelligent. It's being more and more data-driven, and hopefully can be more democratized around the planet. And it's enabling us to have new skill sets. I got up this morning, I was feeling inspired to do some sort of digital art, and of course, I didn't do that digital art by myself. I had a little bit of help. We've all been getting new help from platforms like DALL-E and ChatGPT. It's really quite incredible. We're going to be discussing the implications of GPT-3 and soon to be released, rumors that this week potentially, ChatGPT-4. So huge implications across health and medicine. I think it's almost a bit of a frame shift, almost like when the Gutenberg Bible came out, or when we first experienced the internet some 25 years ago. So I think a lot of things are going to be riding that edge, and it can even start writing talks for you from different ways. I'm sure you've all been playing with it, and there's going to be many, many applications that we'll be exploring. And I think we'll almost enter this new era of what I like to think of as almost generative health. We'll all have our own sort of health avatar that gives us the right AR experience, the right music, the right diet, in a way that is matched to our personality, age, culture, with the right nudges at times. So huge elements I think are going to come out of this generative forum. So watch that space. We'll be discussing a lot of it later today and over the next couple of days. So of course, health is the focus. I think more health than on the sick care side of the occasion. Health, of course, is wealth. And a lot of what we're going to be discussing is not about any one technology or buzzword, but how they kind of super converge and give us this opportunity to move from often the sort of siloed universe to this sort of new or metaverse into this new health age. And we've seen a lot of changes happen, even since the decade we started here at the Hotel del. What used to fit on a desktop now fits on your FDA-cleared wearable device that can diagnose conditions or guide care. And if I look back, to when I was a Stanford medical student, most of these technology fields at this sort of convergence didn't even exist, whether it's computational biology or designer antibodies or AI meets radiology or CRISPR-based gene editing, or induced pluripotent stem cells. I mean, a lot of these have only been tools we've had for the last decade or so and are now giving us this opportunity to really rethink and reimagine health and medicine, not just now, but into this next health age era. And so our goal, again, over the next few days, is to think about where are we now, what's coming in the near term, and what is that next 5- and 10-year perspective. So when we're back here in 2033, we can say we really played a role in accelerating next. And again, not just on the disease side, but thinking about precision wellness. We're going to have Leroy Hood as our keynote this evening, a real father figure and instigator of precision wellness and phenomics. And that helps us think not just about, living forever, that's a long time, but health span, the quality of life. We want to be 120, make it the new 60 or 70. And we've seen that sort of emerge over the last few years. This is a picture of my wife's grandmother holding my 8-year-old son's hand in Jerusalem last December. She turned 104, right? And she's amazing. She speaks 7 languages, 104. We're on her 100th birthday as well. And also thinks not just about the social determinants of health, but even the social determinants of health that have helped her live a pretty healthy 104 years. And we're going to see lots of changes in the health span space going forward we'll be discussing. But we're still in the now, right? We need to understand where we are, where we're going. If I go back and visit Stanford or MGH where I trained, we're still in the fax machine era. We're still getting paper forms. When I had a cardiac study done a year ago at Stanford, I got my results on a CD-ROM. I don't even own a CD-ROM player anymore. I'm not sure about you. Can I borrow yours? So we're still sometimes stuck in the old, not just mindsets, but the architecture of the past. We're still back to waiting rooms. Telemedicine has certainly emerged of the pandemic, but it's somewhat shifting back. We're still seeing lots of new data, but lots of old silos in how we organize our data or even organize our healthcare information. So we have a real opportunity to connect the dots into a new integrated biomedical, just-in-time health database that will be hopefully available to all around the planet. And as we go sort of forward into this age, we need to think about disruption, of course, and many of you are disruptors. We've seen all sorts of fields be disrupted over the last 10, 20 years, from how we do our digital banking and entertainment and beyond. And of course, since we were last year, we've had pretty horrible disruptions from the COVID pandemic, which certainly isn't over, but in a sense was a bit of a catalyst, right? It reminded us that many fields have reached that 4th industrial age, but health and medicine is still often stuck in the 3rd or maybe the 2nd industrial age in some parts of the world, including here in the United States, where we spend more per capita but are way down on the list in terms of outcomes. So the optimist in me sort of looks at COVID as a bit of a chief transformation officer. It really helped spur things. What used to take 10 years often happened in 10 months or 10 weeks. And we need to take some of that energy going forward. and to remember some of these big seismic shifts. Just like Sputnik set off the space age, COVID has sparked a bit of a new health age. And at NextMed Health, we want to be the instigators of keeping that health age moving and accelerating going forward. And that was the topic of a TED Talk I did a couple years ago. But it's a reminder that we can't lose that sense of urgency. There's all sorts of grand challenges, and it doesn't take a pandemic to catalyze them. So here we are back at the magical Hotel del Coronado for NextMed Health. And again, it's been 10 years since we were here. And we have some amazing faculty returning, including Dr. Tony Young bringing a bunch of his NHS clinician entrepreneurs. Are the NHS in the house yet? We have a few of them. Awesome. And I love this quote that he shared a few years back on this stage from John Maynard Keynes. The difficulty lies not in the new ideas, but in escaping from the old ones. And a lot of people here have the new ideas, but sometimes our colleagues outside of this room and outside of NextMed Health might be stuck in the old ways. So we have to think about not just the technology, but moving our mindsets forward. So, again, we've been here 10 years in our new iteration, and it's time to think about this next decade. And so as we go back 10 years, where we are and where we are next, again, we don't want to have a failure of imagination. There's one of my favorite quotes from Bill Gates. Those people tend to overestimate what they can do in 1 year, and underestimate what they can do in 10 years. The last 10 years were pretty amazing, but the next decade is going to be quite surprising and is only going to continue to accelerate. So where were we 10 years ago, right? Genomics wasn't new 10 years ago. It was at 10 years into genomic evolution, but I could meet a cousin through my 23andMe. Esther Dyson, we're the funders of that company, is on our faculty. 10 years ago, it was about a $10,000 genome. Now we're arguably at $100 or $200 US. That's going to give us all sorts of opportunities if we can connect the dots. We've had our genetic information for a while, but still getting our pharmacogenetics into the workflow of a clinician might be a problem. We're going to start understanding diseases at the genetic level and defining it not just as type 2 diabetes, but as one specific subset, and really having that part of the workflow of the clinician and of the patient. And it's not going to just be, of course, genome. We're going to be talking about the proteome, the exposome, the sociome, the microbiome, all the sort of elements that when you take them individually are okay, but when we mash them up into this often over buzzwordy digital twin era, will start to give us new insights that are data-driven and can be truly personalized. So I think we're entering this true era of the digital twin, which will enable us new ways to do precision wellness, optimization, early diagnostics, and much smarter personalized therapy for those who need it. So, of course, exponentials haven't gone away. I think you're all familiar with exponential technology. Moore's law is continuing, despite the fact that the physics are reaching their limit on transistors. Quantum computing is likely to be playing a huge role in everything from drug discovery to understanding our digital biomarkers over the next few years. So watch that space. And of course, our mobile devices continue to accelerate. My iPhone 14 is already antique. Rumor has it the Apple augmented reality glasses will be out this year. That'll have a ton of healthcare applications. They might soon dissolve into our contact lenses and give us augmented reality for a surgeon or for a patient or anybody doing a workout and wanting to visualize the world in new ways. And these often start a bit kludgy. You know, you don't want to be over hyping things, but they have tremendous opportunities to give us new ways of interacting with information. Digital coaching that match our age, culture, language, nudges that will make us work, not others. And of course, we're at the super age of augmented virtual and extended reality. 10 years ago at NASA Ames, we had the founding team from Google Glass, or still my now broken Google Glass, and Raphael, you'll hear from Raphael Grossman, who then from that meeting become a huge instigator of taking AR, VR, and XR into the operating room and beyond. So tremendous opportunities now to take all these massive data sets and make them actionable insights at the point of care. And I think what this is going to enable for all of us, whether it's ChatGPT or beyond, to kind of go from what's equivalent of driver assist to clinician assist in many endeavors and upskill almost all of us around the planet to provide better self-care or better health care. So other tools, of course, have advanced. Virtual reality isn't just for putting grandma on a roller coaster. That's always fun. But we'll hear from Brendan Spiegel and others about the ability to use VR for therapy, whether it's for physical therapy, for treating pain. I spent 100 days straight doing VR workouts early in the pandemic, and on my Apple Watch, I could track that my resting heart rate went down by 10 points. The gym were closed, but the VR wasn't. So new ways to get engaged. And we'll hear from our longtime faculty member, Shafi Ahmed, about medical education in the metaverse and enhancing surgical education and beyond. And of course, diagnostics. You know, where are we now? We're in the era now where we have gone 10 years ago from the very first diagnostic devices on a smartphone, IBG star for blood glucose, to now, wearable glucometers, and some that may be built into our Apple Watches and smart devices seamlessly. We've got Dave Albert here, who was back at our original Future Med 10 years ago, had the very first prototype of the AliveCard device. Now you see ads for it. You can buy it on Amazon. There's the 6-lead version, maybe other lead versions, and you have a credit card version. Now millions of EKGs done per day and scaling insights. So Dave, huge props to you. We'll hear about him in digital health sections tomorrow. Blood pressure, which used to be stuck on a cuff, now can be done seamlessly. I'm wearing a new device from a company in the innovation lab that can do 24/7 continuous blood pressure, and others that might soon do blood sugar. So what are we going to do with all that information? How do we make it useful? Do we need to wear anything? Invisibles are now here. Your camera can pick up vital signs. In many regards, we're all going to be doing an interesting demo with Bina.ai, where you're all going to start crowdsourcing our vitals. So watch that space. We're going to be doing some experiments with that here. And of course, the smartphone has evolved in many interesting ways, even over the last decade, to enable us to innovate, to use the microphone and speaker to pick up an ear infection, or basically to do a medical selfie, not just for vital signs, but to look at a wound for helping a wound care nurse or patient, or the idea of instead of taking your urine to the lab, as one of our prior faculty from Healthy.io has demonstrated, now through the FDA, you can just dip your urine dipstick at home, take a picture with your smartphone camera, which has gotten exponentially better, and have your urinalysis anytime, anywhere, for screening for a UTI or preeclampsia or early signs of kidney disease. So huge things have advanced on this exponential. And something we've seen also in the now of the pandemic is using voice as a biomarker to pick up early signs of neurologic disease, mental health issues, or certainly the idea of cougholytics, sort of digital voice acoustic epidemiology, as it might be called. Is that a common cough? Is it croup? Is it a cold? Those will start to be picked up 24/7 as well. So what gets interesting with all of this, it can start to give us new insights into what drive disease, often which are somewhat based on our genetics, but often are based on our behaviors. And of course, it's only, think about it, what, 13, 14 years since the first Fitbit? I'm wearing like 5 different wearables right now. How many folks have a wearable on in here, right? But how many folks have ever shared that data with their clinician? Like 2% of you, right? So it's still pretty rare that we can take all our wearable and otherable data and make it really useful in the not just the wellness side and consumer side, but on the healthcare side. And I think we're going to see a huge shift in that regard, because these devices are getting quite miraculous. You can now wear a small patch that can be basically a 24/7 ultrasound. Our socks can pick up signs of early foot issues in a diabetic. Underwearables, Internet of Medical Things. In 10 pairs of underwear, you're always censored for tracking COPD or COVID. Ringables, I'm sure many of you have different versions. I've got 2 of rings that can track health information. And what gets interesting about these is not just for tracking sleep, which of course is an important element we're all better appreciative of, but can pick up things like signs of diagnosed pregnancy 6 days before home a pregnancy test. Or, as was demonstrated with UCSF, can predict a COVID booster titer just based on vitals from a consumer medical device. So interesting applications how we can take sometimes small data and glean basic insights about ourselves or at the public health level. And then the ability now to take what used to take an intensive care unit level of data and stream that from a low-cost, $1-a-day patch is going to have really interesting implications from our, hospital to home or hospital hospital movement, where care happens, enabled by data, but the insights are what's critical. And of course, other ways to measure information now, breathables are coming to market. And the question is, especially in the next decade, what are we going to do with all of this digital exhaust, our digitome? How do we make sense of it? How do we integrate it into our care? How do we leverage that into our most important drug? Food is medicine. We're going to be hearing from the CEO of Eat Real, the importance of food in pediatrics and beyond. How do we not just have these one-size-fits-all diets? We can measure input. We can start to measure output. All these new ways of measuring data at home. And it sounded like science fiction, but now there's these 7 companies building versions of this sorts of technology. Continuous glucose monitors. When we combine metabolome, genome, and other elements, we'll start to really hopefully move the needle on precision nutrition to help us keep well, but also manage disease going forward. And of course, we're going to learn, we have a whole section on the future of diagnostics, whether it's new ways to image your brain with AI-encoded information, all the way to, I recently last week had a full-body MRI from one of our NextMed Health partners, Pronuvo, who we'll be hearing from. Incredible abilities now to get a full-body MRI done very rapidly, and gives you a beautifully insightful report that you and your clinician can use. So new ways to interpret that as well. In the next decade, I think you're going to go to your corner CVS, Walgreens, Walmart, Boots, and get a full-body scan, maybe in 10 minutes, read by the AI radiologist, and hopefully democratize forms of diagnostics. Because these sort of imaging devices are getting cheaper. The Hyperfine device, it's portable, it's 20 times less expensive, it can bring care almost anywhere. We're going to hear from Mary Lou Jepson with Open Water, now bringing diagnostics to a wearable device. Big lay Mary Lou. So that's progressed. So whole new ways to think about where care happens. And so as a clinician or as a patient now, we can leverage our new, not just digital doctor's bag, but the community health worker from rural California to rural Rwanda can leverage these tools. It could be a smart ultrasound of EKG matching stethoscope. These were in our innovation lab 7 or 8 years ago. Now they're a booming company, Echo Stethoscopes. Or maybe the era of the stethoscope is going to go away with this sort of now AI-empowered, low-cost consumer ultrasound devices, which again can go around the planet and bring care anywhere, almost by anybody. And we're going to have on our faculty the CEO of Alara Health taking sort of this technology into Africa and beyond. So tremendous opportunities to democratize diagnostics and care. The challenge, of course, these all generate lots of information, but how do we make it insightful? We're all aware of AI or augmented intelligence or intelligence augmentation. Of course, there was a lot of hype, and there is hype about it still today. So, just because IBM Watson wasn't a big success as we expected in the first 3 or 4 years, now 10 years later, we have dozens of FDA-cleared radiology and AI-based platforms, for example. So it's really starting to hit the road. So just a reminder, not just of Moore's Law, but of Amar's Law. We sometimes tend to overestimate the effect of a technology in the short run and underestimate in the long run. So part of our imagination here at NextMed Health is where might we be in the next decade, and how do we help that happen in smart, equitable, and accessible ways. And of course, there's amazing examples in radiology, in pathology, even your gastroenterology visit might be enhanced by AI. It's starting to be already. It's starting to democratize diagnostics again in all sorts of locations. And of course, the challenge is how do we mesh with this, the human component? We're not going to get rid of the need for human touch and eye contact. How do we sort of blend those modalities together to be sort of collaborative, not competitive? And a lot of that seems to be coming together in what's now not a new field, but this convergence of what's often called digital health or mobile health or connected health, the ability now to take these new forms of data and make them actionable at the interface, so they match the patient, the clinician, the caregiver, the health system, and the incentives and the payment models. And that's a big challenge to meet those challenges and to show that these digital health tools work. We have our friends from Node Health will be doing a workshop on Wednesday as well. So we need to cross-collaborate in this new digital age. And think about not just prescribing drugs and devices, but increasingly digital therapeutics, which are now a higher number of FDA and CE cleared examples, whether it's for smoking cessation or, of course, in mental health, which is a big unmet need exacerbated by the pandemic, or to treat kids with a now FDA cleared video game to treat ADHD with a game, not with a drug. The challenge is there's a lot of these technologies out there. We don't necessarily want a wearable for every condition or an app for every condition. I think we're going to see a lot of consolidation, a lot of more omni-channel elements as we go forward to integrate these into our care, not amongst thousands of scattered platforms. So part of the shift, now that we have some of these new tools and platforms, however, is to take ourselves from the quantified self era that many of us are who have some sort of wearable or otherable into the quantified health era. And again, to connect the dots between the data and what's actionable for you, your nutritionist, your workout coach, or your AI clinician. And we do now have new ways to measure, whether it's your voice as a biomarker or beyond, to diagnose diseases, hopefully at stage 0, not stage 4. And then therapy could just be much more tuned, whether it's a molecular-based drug or an immunotherapy or the right digital application. And we now have the ability now on our mobile devices to integrate that, and now at the press of a button to share it. We're in the sharing economy. Many folks aren't comfortable with this. Sometimes the HIPAA laws are a bit antiquated, but we have the opportunity to learn from each other. That ability like Project Baseline from Verily or the All of Us trial out of the NIH. Now hundreds of thousands of individuals sharing their genome, their medical data, their genetic and their digital health information to sort of build that roadmap. So we can have sort of what I like to call predictalytics, really understand a bit of our personal journey and learn from those around us to have a bit of maybe a FICO score for health or that kind of check engine light for our personal body or for our community or for our patients. And one of the leaders in that instigation of check engine light for the body, Dr. Mike Snyder, the chair of genetics, will be here giving a keynote speech tomorrow morning, doing some incredible work, not just with digital data, but now multi-omics and beyond, and even work that they published in the pandemic showing your wearable device could predict a COVID infection 2 days before your COVID test could. So diagnostics in the next decade, I think, will bring us to this era of what's next, where the minority report will diagnose disease before you even know you have it, and maybe even start to fix it, whether it's in vivo gene therapy or other novel applications. So it's a challenge to make sense of all these new platforms. So I like to look at pain points. I encourage all of you to find a pain point and solve for it. One of those I found was to make sense of these. So I launched with colleagues, including Parisa Vatanka and others, Digital.Health a few months ago. It's a platform where you can now have a bit of a digital health formulary and search for everything from digital diagnostics to therapeutics. Use it as a discovery engine. Put your own solutions in there. It might be finding a device like CardioMobile and understanding its data and putting your own digital formulary and starting to prescribe it to your patients. Again, it's not enough to have the technology, but to integrate it into care going forward. All right, so we now have all these new forms of data sources. It's, again, a challenge to make sense of. Of course, AI is going to play a role, but we need to understand that data is just a component. This is a cartoon drawn by Dave Zabowski, who's back this time as well. What is it, Doc? Just as I thought, you're generating too much data. We're all data fiends, and data may be the new oil, but it's not enough. We need to, again, connect the dots and close the loops in the workflow. Workflow still seems to be the key step to get these technologies adapted. We know about all the issues of burnout sometimes from the technology and EMRs that often aren't physician-friendly. So we need to think about integrating and making care better and unleashing the human side of the equation. And a lot of that's going to be, crowdsourced. Just like we can build a map of Rome in a day from drivers using Google Maps or Waze, we're increasingly going to enable each of us to become not just an organ donor or blood donor, but a data donor, and to make sense of that information, and to engage each of our patients and ourselves with that information, not just the data, but the insights. And that is now the ability to almost join a clinical trial virtually. When I got COVID in early 2021, I joined a virtual trial for fluvoxamine. Sign up online, have the drugs delivered. We can all become engaged as data donors and learners, whether it's platforms like Quantified Citizen or platforms like Stuff That Work. Now thousands and millions of individuals sharing their conditions, what's working and what's not working, and collaborating to make that useful information. So last component here is, how is care shifting? Of course, telemedicine is not new, but now we're in an era where we're shifting from our old school version of intermittent episodic data that led to our sort of reactive mindset, waiting for the heart attack, waiting for the stroke to occur, waiting for the late stage cancer, entering an era that can be much more continuous, much more proactive, much more anytime, anywhere, bringing care and hopefully more accessible and democratized ways at lower costs with better outcomes. And I think that's part of our mission here at NextMed Health going forward. And to drive, from hospital to hospital and this new era of care anywhere to improve outcomes and experience. Of course, many of us experienced our own virtual visits as patients or as clinicians. That's going to shift quite dramatically over the next era. We have the founder of Ada Health here, the chatbot era, where you can ask smart questions. That's going to get better and better, where your avatar might show up, the one that matches you. I can turn up as a hologram now. This is at CES a few months ago. You can all enter the metaverse while you're here over the next few days. We have several examples of the metaverse. You can all have the opportunity to be turned into your own avatar in the innovation lab, so watch that space. That'll be a cool experience. And that begs the question, and when we can interact those ways, how do we teach the medical students, nurses, pharmacists of the future, not just have good bedside manner, but good website manner or good metaverse manner as well? Okay, and lastly, we need to understand, of course, not just the digital determinants of health, but the social determinants of health. We've learned through the pandemic about the exacerbated disparities and how we can play a role in meeting those in new ways. We have our sort of Maslow's hierarchy of needs. Sometimes they're digitally based, and do people have access to information and battery life? And so now we need to think about this new era of where 50% of the planet are going to be connected through the 50% of non-connected folks will soon be online, so tremendous opportunities. So to kind of wrap up here, we've already talked about too much data. I'm already over time, which is a bad precedent. We don't want just data. We want to move that to actionable information and insights and narrow the gap between something being published and learned to what's useful at the bedside or the website. So I think we are entering this new amazing health age, the one that I think this incredible NextMed Health community is going to help accelerate. It's not about any one technology. It's not where we are today. It's where it's going to be near and next at its super convergence. And it's our role together to be thinking, again, not just about 2023, but 2023 and skating to where the puck is going to be, and to play a role, again, not being in our old now mindset, but moving to next, from intermittent, episodic, one-size-fits-all, provider-based sick care to a near future and next future that's much more continuous, much more proactive, much more hybridized, much more crowdsourced in terms of knowledge, enhanced by AI and the big data element, and can be aligned with our incentives and our needs at the local level. So it's our opportunity to not take incremental steps, but exponential ones. Many of us are and have been building this new age of health and medicine. And again, it's not equally distributed. So it's our opportunity, our mission here over the next few days at NextMed Health to boldly, collaboratively build that future of health and medicine for all. So with that, welcome to NextMed Health. Thanks for being here. Let's get going.